Hello, my name is Bonnie Moon, and I am a student at Brandman University in the Innovation in Technology and Information Access course for the DNP program, Doctor Nurse Practitioner. The purpose of this innovative video proposal project for this course is to focus on leveraging emerging mobile information technologies to enhance evidence-based practice. I am proposing that using telehealth technology in healthcare will lower the cost of patient care, increase access of care to patients, and increase patient satisfaction. I will be summarizing what is known about the problem with the U.S. healthcare delivery system, the problem with access to healthcare, and poor quality of healthcare. I will be going over the history of the U.S. healthcare system, the solutions that have been tried in the past, and proof that telehealth is a qualified solution. I will discuss who helped me while making my proposal and the innovative application I want to create that will contribute to solving problems with U.S. healthcare and one day globally. Finally, I will discuss what makes my application innovative according to my course's textbooks, readings, and literature. Now I'm going to show you what research says about the problem of healthcare in America. In this study, it focuses on a perspective of public's assessment of access, coordination, patient-centeredness, and chronic care management. It did a study of 11 countries, and they questioned these 11 countries. And what they found is, on average, U.S. adults reported poorer health than their counterparts, and over 28% of U.S. adults reported that they had at least 2 chronic conditions. 26% of U.S. adults said that they had experienced emotional distress in the past year that was difficult to cope with alone. U.S. adults were the most likely to report financial barriers to health care, with 33% reporting that they had a cost-related access problem in the past year, a statistically significant decline from 37% in 2013. This research article shows the U.S. healthcare system in 2010, problems, principles, and potential solutions. 10 years ago, so that would be 2000, the U.S. healthcare system was declared broken. Since that time, the system has not improved. The fixes promised by health maintenance organizations have not materialized. Healthcare premiums are again on the rise. Hassles for patients and physicians abound, and there are now almost 45 million people uninsured, about the same amount as the entire population of Canada plus Australia. Problems that 10 years ago were considered affect only isolated parts of society now are beginning to encroach on all of us. In the next 10 years, which is now, the current and accelerating trends with costs and the uninsured will reach a major critical junction. Okay, so as physicians, we can start moving towards this new system today by piloting new programs to get us there. Most of these ideas can be started now. We can develop and use electronic medical records with embedded quality and payment systems. We can support efforts at severity adjustments for premiums. We can gather and analyze process and outcomes data, improve patient care, and create guidelines based on the evidence. And we can teach our patients to recognize quality. Those of us who are employers can pilot effort towards defined contribution of premiums and the infrastructure to support it, allowing our employees to choose their own healthcare. We can urge our states to develop programs for all citizens similar to those available to state employees. These would be great models for the regional agencies. This article talks about the history, problems, and solution of the healthcare system in the U.S. Even though we foster excellence and innovation in places, the combination of underinsurance and overinsurance has left the U.S. with the highest healthcare costs in the developed world and some of the worst overall health outcomes. And so fixing the country's healthcare system is complicated. So we have to take into account of the experiences of the other industrialized nation. And you cannot rely on free market competition to reduce the premiums while ignoring the costs of medical care. So you have to lower the healthcare costs. And so I like to go over this a little bit. $3 trillion annually is what we spend on healthcare, and that's more per capita than any other healthcare plan or in any other country in the world. And so we're 50th of 55 nations on efficacy, on efficiency. And then let's see. Let's just show you a little history. Healthcare started in 1883. It started in Germany first, and we were one of the later developed countries to adopt the health insurance plan. And so some catalysts are the Blue Cross plans, and sulfa drugs and penicillin because they were going to the hospitals more, Stabilization Act, and growth for-profit health insurance, lower premiums, self-insured plans, and efforts to reform healthcare following World War II. And then our newest innovation is the Affordable Care Act in July 2009. And that was a requirement of everyone to have insurance and to give it for free if you're poverty level. And so basically that's the history, and it's talking about mostly that we have to drive down costs in order to fix the problem in healthcare. This is a wonderful article I found. Transforming healthcare from the ground up basically means that we can't fix the problem by just fixing issues within the system. Sometimes we need to fix it from the ground up, meaning fix the entire system. So in this study, it shows University of Mississippi Medical Center. They created a homegrown telehealth network to increase patient access to care. And Iora Health developed a new business model that doubled down on primary care to reap large savings in secondary and tertiary care. So this article shows proof that telehealth is wonderful, and it reduces costs and it reduces access for patients. So the Mississippi's telehealth network has saved lives and money, and has revived struggling rural hospitals and communities. 10 years out, satisfaction is high among patients, 93.4%, and local hospital administrators, 87.5%. Over 7 years, Iora has reduced hospitalizations for its patients and by 35 to 40%, and lowered its total healthcare cost by 15 to 20%, while improving the patient's overall health. So I think this is really great proof that telehealth is a good solution. And the last article I'm going to show you is that Health Affairs article, Telemedicine, a solution to address the problems of cost, access, and quality. So with a growing physician shortage, rising healthcare costs, and a need for increased measurable quality, we have a responsibility to make changes in how we conceptualize and deliver care. So this is a time for innovation. And the patient consumer wants access to primary care on their term, not on the terms of the healthcare industry. Telemedicine offers this opportunity with maximal convenience to the consumer with equal quality and a much reduced cost. Telemedicine is a tool that will transform health delivery for the better. Instead of showing you a mobile application that will solve the problems with U.S. healthcare, I'm going to actually show you an application that I proposed to make. And this is an actual module outline of the application from the app developer that is going to be working on the project. And so quickly going through, this just shows the application modules. There will be a patient module for easy access for the patient, nurse module, inventory management, and administration. So for the patient module, they will be registration and profile management to make it really easy, and all done through the application. Background check for safety, appointment management for ease of handling, and handling payments. So all the payments will go through the third-party integration. And signing documents are all going to be done through the application, and notifications will be done through email, text, and map services so to show where the doctor or nurse is coming to them, to their home. And the nurse module will show a different view, and both will be HIPAA compliant. The registration and profile management background check of the nurse as well, to make sure that it's a nurse that's safe to go to the patient's house. Appointment management, nurse supplies pickup, so a basic supply management, charting, EMR integration. Everything is going to be integrated within the app, signing docs, and again, notifications and map services. So the nurse can track her miles and everything also with the application. And there'll be an inventory module for ease of knowing how much supplies, and for ordering more supplies that will be actually mailed to the nurse's house. And administration, so this is on the back end, being able to access the app for packages, services, registered patient search, and basic reports, and appointment search, and going on. It's going to have the best technologies to make sure it runs quickly, and it can have a lot of people signed into the application and registered with the application. And so this is really the way of the future. And as you can see, it's really expensive. So I am, definitely have to have an investment for this. But with solutions to healthcare, sometimes it takes a cost in order to save. But it's the outcome, the innovative outcome at the end that you look at. And it's definitely going to save prices, not having a brick and mortar somewhere where we have to pay rent, and it'll definitely increase access to patients. And sometimes you don't even need to have a patient visit, and you can just handle it over the application, like via Skype-like technology. And looking on my website for LifeDrip, you can see right up here who I collaborated with, my team, on developing the application. Here we go. So basically there's me, CEO, the naturopath. He helped just to make sure that I had everything clinically needed within the application. This is Jasmine. She was my assistant. She helped me innovate the ideas and the things that I would need to have in the application. This is Dave Henderson right here. He helped me find the app developer and helped me interview them. And so basically those are the people, and not pictured here, but my investor, he's going to be the one that actually invests in the application. Now I'm going to be talking about what makes my proposed solution innovative. Basically, I used information from the Medici effect because it was my favorite source of information from our readings and literature and textbooks that shows relates to my way of it being innovative. According to Franz Johansson's The Medici Effect, working on an intersection is when you master a specific field that you collaborate ideas to innovate something completely new. When I created LifeDrip, I copied the telehealth IV hydration business model from a company called Hangover Heaven in Las Vegas. This was directional innovation because it was something that has already been done. The outcome is known, and I just brought it to a different state. I have since thought of an intersectional innovation business model that uses methods of Uber and combines it with IV nurses through the development of an application. So that's where I have the most innovation, is because I took one business model and another business model and I'm combining them together. Here are the references for my telehealth video project proposal. And I hope that the information inspired you to think of innovation in healthcare systems from the ground up level, and how telehealth applications can improve healthcare, especially with the U.S. healthcare system, improve access, improve patient care quality, and patient satisfaction. Thank you for your time.